have higher. Now, breast cancer is not as a killer as many women think. As a matter of fact, we are curing today thousands and thousands of breast cancer ladies. And they not only are cured, but they are living without disfigurement of their bodies, meaning they are keeping their breast intact. Now let me talk a little bit about family history. I see a lot of women who have breast cancer, and I can tell you from my own little experience, and it's not published, of course, I don't see many BRCA1 or 2 as common in Middle Eastern ladies compared to American. I'm not sure why, but that's of course a blessing. But generally speaking, 85% of all who will develop breast cancer will not have family history. So it's not because you do not have family history you are protected, but also those who have breast cancer, the chances of not ever having any other person in their family without breast cancer is very high. So 85% of all breast cancer ladies are solo or de novo or without chromosomal abnormalities. The other 15% are related to some genes, whether BRCA1 or 2 or many other genes that can affect the genetic or hereditary type. Now let's talk first about mammograms. Mammograms is indicated from the age of 40 and above to start screening once a year. Now, if you were to have a mother who had breast cancer, we like you to start earlier mammograms. So for example, if your mom had a breast cancer, you need to start 5 years earlier than the date of her breast cancer diagnosis. So for example, if your mom was diagnosed at the age of 40, you need to start getting mammograms at the age of 35. Okay? So far, mammograms are indicated 40 years and above once a year. If you have a family history of cancer, you need to get a mammogram slightly earlier. We like it to be 5 years before the age of the diagnosis of your relative. Of course, if your relative got it at the age of 60, I don't think that's a factor anymore because you're probably getting mammograms. Okay. Now, we as oncologists advise that you take mammograms once a year forever, although there are a lot of recommendations that you can stop at the age of 70. I personally do not recommend that. I think mammograms can be done for life, once a year. Now, mammograms are not going to expose your body to X-rays, and there is no harm of getting a mammogram once a year. The X-ray that related to the mammogram is very minimal and it will not affect your body. There is also a sonogram. A lot of Egyptian and Middle Eastern women have what we call dense breasts, where when we see the mammogram, we cannot see very well the architecture of the breast, and that's when either we get MRI or a sonogram. We do not normally get MRI in every case. We do it in dense breasts, in patients who have prior treatment for breast cancer, and in patients who have multiple diseases of the breast. Sonogram, on the other hand, is a very simple test and there is no radiation related to it. So we advise during the mammogram that also dense breasted ladies to do a sonogram. Okay. Now, one of the very important things that we recommend to ladies is to self-examine their breasts. Self-examination of the breast is a very easy task, and all ladies and young ladies need to learn how to do it. Basically, has to be done in the middle of the cycle during what we call ovulation or day 14, where your breast will not be as tender or as swollen. Normally, you need to look in the mirror as you are watching me now. You put your hands and you want to see if the shape of your breasts looking similar. There is no dimpling. There is no inversion of the nipple, meaning one nipple is going inside. There is no redness. There is no rash. So after you look, what we call inspection, you go for what we call palpation, and you use the palm of your 3 or 4 fingers, and you go and you do rounded circles in all the quadrants of the breasts, up, down, sides, and then at the nipple itself. We like you to do that possibly in front of a mirror or while you are taking a shower, so the water and the soap allow you to slide your hand like as I'm doing to myself, because this type of feeling will make me feel if there is any tiny nodules. So the way I'm doing it to myself now, if there is any palpable nodules, you should do it. Not that this is as important, but I want to say breast cancer can happen to men, and actually sometimes is more aggressive in men, and breast self-examination is as important for men to make sure there is no lumps or bumps. So to go back again, you look if there is any asymmetry, you look for any nipple changes, then you, with the palms of the tips of your fingers, you do rounded circles all around the breast, and then in the area of the nipple. Then you bring and you slide your fingers and you try to press a little bit to see if you feel anything. Most doctors recommend that you do that also lying down while your arm is up, and you do the same exact 2 things again now, because you are pressing your breast against your ribs, so if there is any palpable tiny tumors, can be easily felt. It's common to hear from many of my ladies about nipple discharge or nipple bleeding. Now, the nipple discharge and bleeding are hardly related to cancer. Most of the times, over 90%, has nothing to do with cancer. Could be related to hormonal changes, could be related to some inflammation of the breast, and sometimes it could be related to a tiny little polyp or a benign tumor inside the ducts of the breast, and because of that you are getting the milky discharge or the bloody discharge. Even that, normally we do not consider this as malignant. What happens if you feel what we call a lesion, a lump, an irregularity of your breast? Please do not panic. More than 2/3 of these palpable tumors are not cancer. Actually, the harder sometimes is not cancer. So please do not panic. And number 2, please do not ignore it. Believe me, and I'm speaking here as a physician who has more morals because of my Christian attitude, there is a lot of help can be given to all ladies when they come to us with abnormality in their breast. So, If you have a palpable tumor, please go to your doctor. More than likely, he or she will examine you, will confirm what you felt. More than likely, they will send you for mammogram and a sonogram. Upon review of that, we are going to decide if you need to be watched because the likelihood of cancer is so low, or we need to take it out, or we just need to biopsy it, take a piece from it. This lesion, this irregularity, more than likely will need to be biopsied at one time to make sure that this is not malignant. The word malignant and cancer are similar, and the word benign is like the non-cancer. Okay. Now, the types of lesions in the breast are not usually masses. Sometimes you cannot feel them, and that's why even if you feel nothing and you are 42 years of age, you still need to get a mammogram. The reason is, a lot of times the areas that we worry about in the breast, you cannot feel them. It could be calcifications, and the calcifications could be benign, non-cancer in a lot of times. It could be like milk got stored or trapped in a duct, and with time they become calcified. Very common, we see it all the time. We do nothing about it because this is not a disease we need to treat. Sometimes we see what we call microcalcifications. This is a very early, could be a very early cancer. We call it stage 0 because it's a precancerous condition, and normally we like to take it out because we do not want to leave it. Then we can find many things that could be palpated or could be just seen in a mammogram, and a lot of times these are non-malignant or benign. It could be something like fibroadenoma, which is a benign tumor, will never be malignant. Sometimes we still recommend you take it out, but a lot of times we watch it. And sometimes there is a proliferation of the ducts, and if we find it's an abnormal proliferation, we watch it closely, or we put you on a medicine like something called tamoxifen. The reason we do that some of these structural changes of the breast may predispose you for malignancy in 10 years, and because of that we put you on what we call cancer prevention, which is a pill a day to prevent the cancer from emerging. Okay, so I spoke about the chances of cancer, 1 in 8. I spoke that among people who have a mom, a sister, or a daughter, they have twofolds the chances of getting cancer. If they have 2 family members, threefolds. I spoke that the mammogram is an important test and need to be done in all ladies after the age of 40 and beyond. You can stop at the age of 70 if you wish, but if you wish to continue till 80, that's also acceptable. I also spoke about self-examination, and that the self-examination can make the lady go earlier to the doctor if she felt something that she is uncomfortable with. I want to speak for a minute about breast pain. A lot of Middle Eastern ladies usually have breast pains. It's related to their estrogen and related to their menstrual periods. But let me assure you, cancer and pain are very rarely they coexist. Cancer does not present with pain. So if you have pain in your breast, do not be scared. Go to the doctor, find out the reason. 90% this pain has nothing to do with cancer. He just needs to give you medications because your hormones are making your breast a bit tender. The chances of cancer causing pain are so small and usually happens in very late stages. So the chances of this pain related to cancer are so rare. So do not be scared. Speaking of not being scared, I would like also to encourage our ladies, please do not get discouraged that, oh, I know of a lady who died of breast cancer. Unfortunately, that can happen. But believe me, the earlier you find your cancer, the much better your chances of completely curing yourself from it and living well without a problem all your life. We are curing so many women today than we used to do 20 years before. And we are curing women now with keeping their quality of life. Okay, now let me talk a little bit about what do we do when we find that there is cancer. So let's assume I am a lady, I felt something in my left breast. I went to the doctor, he confirmed it. Then they took a sonogram, which is something they massage the breast to get a picture. They get a mammogram, which unfortunately a little painful because they squeeze the breast in order for them to see if this nodule can be squeezed or not. And then they come to tell me, ma'am, we want to be sure, so we are going to do a biopsy. The biopsy is like taking a piece of tissue from that nodule, which we still don't know if it's cancer or not. That biopsy is done through a tiny needle. They give you a local anesthesia here to numb the area. Then with a sonogram advising them where to put the needle, they put the needle in. They take a piece of tissue, you leave right away after an hour. Usually you don't put any stitches or anything. Takes them between 3 to 5 days to come back with the result. The result could be, this is a benign tumor we are going to watch. This is a benign tumor, but we prefer to take it out. This is a very early cancer stage 0, or this is an invasive cancer we need to take out. Those are the 4 possibilities. The first 2 are easy. This is not cancer we want to watch. This is not cancer we want to take out. If they need to take it out, they make a slight incision above the tumor. The breast surgeon takes it out, and then you go home the same day, no treatment after that, and you do your mammogram and a sonogram every year. Okay, how about if this is cancer? The first possibility that this is a non-invasive cancer. The non-invasive cancer means a very superficial, on-the-surface cancer. I just want you to imagine what this means. Imagine you have a little fire that touched the carpet of your floor. So the carpet has a little fire. All what you need to do in order for the fire not to go deep is to put it off, remove that piece of carpet, and that's it. That's what we call a non-invasive cancer. Non-invasive cancer does not need chemotherapy, does not need removal of the breast, but still needs surgery and more than likely needs radiation. The reason is, although it's non-invasive, it can become or lead to become invasive. Because it's on the surface, it did not touch the pipes of electricity and gas under the floor. We don't need to take the breast out. We don't need to go under your arm and do surgery because this is hardly ever, 99% or 98%, never goes to the lymph node. So surgery will entail taking the tumor plus a little bit of a space around it. More than likely, if you are a young lady less than 70, we advise a short course of radiation. Since you did not remove your breast, the radiation is like taking a picture of your breast every day. Usually it's 5 minutes a day, 5 days a week for 4 weeks. Does not affect your hair or appetite, does not give you nausea or vomiting, does not affect anywhere else. The breast becomes a little red, then a little dark in color, then go back to normal. A lot of times we test your tumor for hormones. We see if your tumor responds to hormone if given the hormone from outside as a tablet. If you are lucky, your hormones will be positive. Positive is good, which means we can give you a pill per day for 5 to 10 years, which help the cancer does not come back in either side, not just the left, but prevent it from the right. So that's what we call non-invasive cancer, completely curable, and the chances of not removing your breast are so high. Now let's get to an invasive cancer. Invasive cancer meaning it wasn't the carpet, the fire, but start to going down, and under the floor there is a pipe for electricity, another pipe for gas, and another pipe for Wi-Fi, and we are afraid that the fire may touch one of those electric or oil or gas pipes and then go somewhere else. So we need to be a little more aggressive in treating you so the cancer does not spread. The first thing we do is, one, we do the mammogram and sonogram, and then we do sonogram under your arm to make sure there is nothing lymph nodes here. Then the surgeon will take this tumor and then he takes a 1 or 2 lymph nodes from under your arm. The lymph node is basically the first station when the cancer wants to travel from one area to another. So we take 1 or 2 nodes to learn the attitude of the cancer. Is it going to travel or it's only here? And it makes a big difference. So the first option, that the lymph nodes were negative, we took the cancer out, we analyze it, we find it's invasive cancer that has not gone to the lymph nodes. That's what we call stage 1. Stage 1 is completely curable, and we can keep your breast. You don't have to do mastectomy, so you will not feel disfigured. You will always feel good about your body. And what we do is, after the surgeon have decided you are healed well, we give you the radiation which I described every day for 4 weeks. Then if you are lucky and your hormones are positive, we put you on the pill which goes in your body for 5 to 10 years. Okay. Now, what happens if the lymph node is positive? So not only you had a breast cancer, but the breast cancer went to the lymph node. Now, that's not stage 1 anymore. It could be stage 2 or 3, depending on the number of the lymph nodes and the size, how big the tumor in your breast. So if it's 2 centimeters or less, it's maybe stage 2. If it's 3 or 4 or 5 cm, maybe stage 3. If you have many lymph nodes, it will be 3, stage 3, and so on. Once we find that you have one or more lymph nodes here, we need to decide, you always will need surgery and radiation, always. The question is, do you need chemotherapy or not? And I know many ladies are so scared of chemo, but let me assure you, the types of chemo being used now are different than what it's being used many years ago. And they give a lot of support medications so you don't feel nauseous or vomiting. There are even centers put what they call ice cap under sedation so you do not lose a lot of hair. It's not covered by insurance, but should you want to pay, you can pay, I think it's $2,000 to put the cap on. Let's talk more about stage 2 and 3. They are still curable, may not be 100%, but stage 2 is about 85-90%, stage 3 maybe 75%. I mean long-term cures. And when I say a number like that, that doesn't mean just this is taking hundreds of women. Some of them did a lot better than 75, and some of them did a little worse, but that's the average. Okay. So chemotherapy is usually given through the vein. A lot of doctors like to put what we call a port. It's a little button that's placed under your skin, so they don't keep looking for your veins each time you come in. When you come in, they clean the port, and the nurse put a needle which is connected to the chemotherapy, and hence you don't have to bother your arms every time. Now, not every stage 2 needs chemo. Sometimes we find a couple of nodes, but we find that you have a very favorable cancer in spite of 1 or 2 nodes, and you still do not need chemo. Those are the older ladies, slightly older ladies who are menopausal. The chances of not needing chemo are higher than the 35 years old. Number 2, sometimes we do a genetic test. And if you are one of those patients, ask your doctor, do I need a genetic testing or not? And the genetic testing can be done in 2 ways. One, you want to know if you have an abnormal gene, like the BRCA1 or 2 or P10, or there's about 12 genes. Because if you have an abnormal gene, you need to be yourself careful. And if you have daughters who are going to grow up, you need to alert them. Maybe they like to do their mammograms a little earlier. Now, the genetic testing also can be done not just in you, but on the tumor that was taken out. And they take this tumor and they analyze it for a certain number of genes to know how bad is your risk of developing cancer spreading somewhere else. Or in other words, how much do you benefit from giving you chemotherapy? If we find you are benefiting 7% and less, we don't give you chemo. But if your benefit is 15-20%, we give you chemo. So that's what we called a genetic test, and it has many commercial names. So now, let me answer this question. I had cancer 4 years ago, stage 2. I had chemo and radiation. I am currently cancer-free. How are my chances of recurrence? Number 1, congratulations. You are one of those amazing survivors that we are very proud of. Your chances of recurrence are so low after 4 years. I cannot say 0. That's why you will continue to see your doctor and you will continue to get a mammogram and a sonogram. The chances, however, of the cancer coming back after very effective therapy that you have gotten is very small. I don't want you to live in fear. I don't want you to live scared. Examine yourself. Go to the doctor and get your annual mammograms and sonograms, but live your life to its fullest. Trust in God and trust in your doctors and the therapy you have gotten, and do not always be scared looking in every corner as if it has to come. The chances of recurrence are very low after 4 years. Especially you also had stage 2. So coming back to the genetic test. So the genetic test is a test we can learn what are the chances that you need chemotherapy. If you are 28 years old and you have breast cancer with 1 or 2 nodes, we actually give you chemotherapy without doing genetic tests. The reason is you have so many years ahead of you that the estrogen in your body will expose your breast for possible recurrence. Because of that, we give you the chemo without possibility that we can exempt you from it. Because of your age, sometimes also it becomes more aggressive in the younger ladies. But if you are, for example, 40 and above, and you have 1 node positive, sometimes we do the test, and the doctor may say, ma'am, you have an option. If I give you chemo, I'm giving you a benefit of about 6-7%. Or you can take tamoxifen, which is a hormone pill meant to suppress any cancer cells that may be lurking in your breast or in your blood, and also protecting your other side. So it can be your choice as well. Now let's go back and speak about the more advanced cancers. So all what I said so far are the cancers who are stage 0, 1, 2, and 3. Majority of these cancers, we can keep your breast. We don't have to cut it off. We do not have to do mastectomy. Sometimes, however, because of a genetic test like BRCA testing, you have BRCA positive. As I said, I find it a bit uncommon among our ladies, but still, if you have BRCA positive, especially 2, sometimes we recommend taking both breasts out. Not because you have cancer now, but the chances of the cancer is about 25-30% in your lifetime. So the doctors sometimes recommend that, not because you have a very bad cancer, but you have a gene or a chromosome that makes you more liable to get more cancers in either side. And I've had many women who would do these types of surgeries, and the plastic surgeon will reconstruct the breast, and there are so many types of reconstruction. I'm not going to bore you with it because it's not the main place of our discussion. Okay, now let's talk about the very advanced cancers. Unfortunately, some of our ladies are scared to go to the doctor, especially our elder moms, aunts. Some of them, they feel very ashamed, very scared, very embarrassed. And unfortunately, they wait. They know they have a lump. They feel the lump. The nipple is going in. Maybe the arm is getting swollen. Maybe they feel something under their arm. Maybe they're taking painkillers because the breast is getting bigger or painful. Maybe there is bleeding coming out. Maybe the skin became reddish or pod orange, which is like the skin became very thickened. All what I mentioned now are items for late cancer. I wish you and you tell your moms and aunts and grandmoms, please do not wait for you to see the doctor when you feel something. Sometimes the Middle Eastern mentality, and that's not only Middle Eastern, I've seen it in Russians, I've seen it in many other ethnicities, that they are scared from what can happen, so they don't want to go. And unfortunately, that fear is worse than the disease. I have seen many ladies, once we talk to them about the treatment, they feel so much at peace because they were carrying a big burden, not sure what to do. So, those we need to work much more harder, and we need to do a lot of more aggressive treatment, and unfortunately, because it's a very late stage, we don't succeed all the time. But all these cases that I mentioned, what we call stage 4, and stage 4 meaning the breast is very much containing all cancer, or the cancer went back to reach the muscle, or went out to reach the skin, or we reached out to reach the lymph nodes, or made the arm very swollen. This is our all stage 4. And when we reach that type of stage 4, which is different than stage 4 where a cancer is spread somewhere else, this type must get chemotherapy. Sometimes we do it before surgery because the surgeon will say, I cannot take this breast out. I will not be able to clean it. So we give chemotherapy up front, then we go for surgery, and almost all these cases they have to do mastectomy. And after that they get radiation, and they may need tablets as well. I'm going to answer this question. My cousin is getting calcium injection every 6 months for a long time, and she starts from the side effects. Can she get calcium tablets instead? I'm not sure I understand the question, because I'm not sure why she's getting the calcium injection. Is that because of breast cancer? And if it is breast cancer, I'm not sure why she's getting the calcium injection. If this is because of bone cancer, that may be true. If this is because of osteoporosis, that the bones are frail and not strong enough, and that can happen sometimes with the treatment for breast cancer. Because when we treat breast cancer and when we give him some hormones, especially after menopause, the bones becomes frail, weak. And because of that, unfortunately, they need to be worrying about their bones. So yes, sometimes we give injections, sometimes we give tablets. It's very hard for me to tell you she doesn't need the injections. It could be a good reason why the doctor decided to give the calcium injections. The calcium injection is definitely stronger and helps the bones faster than the tablets, but I really cannot make that decision without knowing all the facts. But this is a good point to discuss though. So although I covered almost as much as I can, or you need to know in a general forum like this, the calcium idea is very important. Our ladies need to know how to prevent breast cancer. You prevent breast cancer by, number one, losing weight. Ladies who are overweight need to work on it because the estrogen may be higher in overweight ladies. Number two, please do not ignore your self-examination and your mammograms if you are 40 and above. Number three, if you do find something, please say something. Do not ignore it. Then bring all your health to be good. Eat right. Exercise if you can. Do a little bit of movement. Don't be always sedentary and sitting down. Vitamins are good. Calcium, especially in ladies above the age of 50, is very important to take calcium and vitamin D. I can tell you almost all Egyptian ladies who did not take milk and eggs enough in their youth, and we tend to fast a lot of days in the year, they come at the age of 55 and their bones, even without hormones for breast cancer, are very weak. If my grandmother had breast cancer, how can I protect my sister and myself from getting it? Is there anything you can do to stop getting it? Number one, having a grandmother having it, that doesn't mean you have the chromosome or gene. You can easily ask when you go with your grandma to the doctor, please do a genetic test for her. If she doesn't have the chromosome, do not worry and do not be scared. And if I were you, just start self-examination at the age of 30, 35, don't delay it than that, and get your mammogram. You can do one mammogram at the age of 35, then the next one at the age of 40, both you and your sister. If she does have the chromosome, however, then you must start at the age of 30 or 35 to get your first mammogram, and every 5 years at the age of 40, you start doing it once a year. You cannot do more than that. But believe me, worrying too much, being scared too much, are worse sometimes than the disease. When I said you have higher incidence to get breast cancer, that doesn't mean it's 100%. It's still 1 or 2 digits. It's still uncommon. The chances that you can live all your life without breast cancer are far higher than the chances of you developing breast cancer. So I don't want you to keep getting scared or worrying. I also do not want you to ignore yourself. Know the BRCA testing for your grandma if they can do it. If she is in Egypt and they cannot do it, then you can wait, or you can ask your doctor if he can do genetic testing for you. Whether it's covered by insurance or not, I'm not sure. But I have met many young ladies who are willing to pay the money, I think $700, to get the, maybe between $200 and $700, depending on how big the test is, to do the genetic test. And they want to know. And by the way, these tests are not only meant for breast cancer, but if the chromosome is positive, we worry about your ovaries, and we worry about your uterus, and we worry about your colon. So sometimes we ask you to do colonoscopy a little earlier if you do have the chromosome. If you don't have the chromosome, and as I mentioned, from my experience, the chances of Middle Eastern ladies having BRCA positivity is less than their counterpart Caucasians or Americans or whites. So I wanted to touch base before I end on the bone health, and maybe another time we'll talk about it in details. Maybe we'll get a guest. We'll have to have a guest who can talk more to us about bone health among women. But until then, please walk at least if you cannot run. Walking and exercises build the bones of a lady. Losing weight builds the bone of the lady. Taking vitamins, especially vitamin D and calcium, exposure to the sun, all of this are great things. Eating vegetables, eating proteins are excellent ideas. Reducing sugar, especially Pepsi and Coke and other things, and any type of sugar, the lower the sugar, the better the bones health in the future. So I want to summarize where we are. This topic, although it's related, excuse me, what are my other treatment options besides chemotherapy? Okay, sorry. Thank you for your support and guidance. I have survived stage 2. Congratulations. I'm very proud of you. I know the person who have sent me, and I'm very proud of her. What are my other treatment options besides chemo? I think you need to talk to me separately because I need to know a little more, or at least I need to be reminded with your case more. But if I remember your case, you do not need radiation for the reasons I discussed with you before. and I don't remember if you can take hormones or not. If your cancer was positive for receptors, then you should ask your doctor for hormones. I have a feeling your cancer was what we call triple negative, if I remember, and hence you got chemo and you got surgery. You don't need to worry about it. I think you are one of the rare people who had the chromosome, so you decided to do a different type of surgery. May God bless you. I'm very proud of you, and I'm happy that you responded back to tell you that you are doing good. Um, my email is available, and CYC can always reach out to me with any of your cases. They are also trying to do an anonymous email, but I want to, before we finish, while we're waiting for maybe another one or two questions, I want to end by 2 verses or 3 verses. Some of the verses I love to tell my cancer patients. Jeremiah 30:17. I will restore health to you, and your wounds I will heal, declares the Lord, because they have called you an outcast. It's Zion for whom no one cares. He will restore your health, and he will heal your wounds. In Joshua 1:9, have I not commanded you? Be strong and courageous. Do not be frightened, and do not be dismayed, for the Lord God is your God wherever you go. And in Isaiah 41:10, fear not, fear not, I am with you. Be not dismayed, I am your God. I will strengthen you, I will help you, I will uphold you with my righteous right hand. Remember, every person who goes through this path, you are actually much closer to the right hand of God more than any one of us. And I'm speaking here from very much experience that I had with so many of my hero friends that went through this. They are the closest to God because He's holding them in His right hand, and sometimes He actually embraced them. Mark 5. This is the woman who is bleeding. He said to her, daughter, your faith has made you well. Go in peace and be healed of your disease. Go in peace and be healed of disease. Another question, how quickly does breast cancer grow? Is there anything that can help slow the growth spreading process? So it's a very good question actually, and I'm not sure, I don't know how to answer it. Normally we don't like to know that there is a cancer and we leave it to see that it's growing. So the rate of growth may not know. But we have scientific models that we can measure what we call the doubling time. The doubling time meaning the time it takes the cell to become 2, and from 2 to 4, and 4 to 8, and 8 to 16, and so forth. And breast cancer is not the most aggressive cancer. There are much worse cancers that can really become active and makes the cancer grow faster. But breast cancer is not the worst aggressive or doubling. Now, there is nothing you could do to reduce the spread. If you have cancer, then you need to get the treatment as your doctor designed, and I try to summarize today. Trust in the system. If you have questions, reach out to me. I'll do my best to help out. And I can tell you the chances of cure today are best and higher compared to any decade we had before. And trust in God. I wish every cancer patient knows that he is a close friend of God. He is giving you this because now he is going to prepare, as we read in Psalm 42, he is going to prepare your bed during your illness. How magnificent his hand when He is spreading the linen and the sheet to make you comfortable in your bed. You are much closer than any one of us, and God is much closer to you than any other time in your world, in your time. And that's why we read this verse, daughter, your faith has made you well. Go in peace and be healed. There is a question about vaccine and cancer. We do not have any indication that the vaccine promotes cancer. No indication at all. As a matter of fact, all of us oncologists give the vaccine as fast as possible to our cancer patients. As a matter of fact, the third vaccine, the booster, is indicated for those who have cancer or immune compromised. The reason is they need their vaccine because they don't want to get their virus to be infecting them, which will delay the chemo, will weaken their immunity, and make them more susceptible to other infections. So believe me and try not to read some of the conspiracies that the vaccine causes cancer, or the vaccine stimulates cancer, or the vaccine makes the cancer spread. Zero evidence regarding these things. I'm enjoying very much your questions, and I want to tell you the two verses one more time. Fear not. Fear not. Do not be scared. I am with you. Do not be dismayed. I am your God. I will strengthen you. I will help you. I will uphold you with my righteous right hand. Daughter, your faith has made you well. Go in peace. God be with you. I hope you enjoyed this episode of Family Matters. I will continue to respond to your questions even after the episode is finished and the days to come. Until we meet again, when we turn our eyes